All right, there's good news and then there's bad news in the latest American Cancer Society report.
Medical Director of the Scripps Cancer Program, Dr. Thomas Buchholz, joining us this morning. Doctor, good morning. Thanks for being here.
Good morning. It's a pleasure.
It seems like we've been talking about this report for the last week or so. Why are we seeing a trend towards fewer overall cancer deaths in the country?
I think that's the good news. Isn't it exciting to see that almost a third of cancer deaths have decreased over the past 20 years, resulting in almost 4 million lives saved.
Wow.
So that's really exciting. I think there's three main reasons. One, cancer prevention. We've done an effective job at decreasing the rate of smoking in the United States from 40% down to about 13%. Also, early detection. I want to emphasize the importance of screening for cancers like breast cancer, colorectal cancer, prostate cancer. And at Scripps, we've adopted a new lung cancer screening program to address the #1 cause of cancer-related death, lung cancer. So for people over the age of 50 who have a significant smoking history now, we have a lung cancer screening program at Scripps through using CT scans, and it's hopefully going to make a big impact. And the final phase, of course, is improvements in treatments. At Scripps, we have a very multidisciplinary approach that offers patients the latest advances in new therapeutics like immunotherapy and new cancer drugs and precision radiation and precision surgery.
I think, doctor, nowadays, I mean, anybody probably watching right now, you know somebody, cancer has touched so many lives that you know somebody who's had it. I mean, I personally lost my uncle to cancer, and I just had a very young family member fight colon cancer. So even though fewer people are dying from it, the numbers, though, are going up. I hear so many stories, especially of younger people being diagnosed with cancer. Yeah,
cancer is such a challenging disease, and it remains a real public health problem. And I'm sorry to hear about your family. It is a disease that really touches almost everybody. 40% of people over their lifetime are still at risk of developing that cancer, and we want to do 40%. Wow. Yeah, it's. So it is a very important problem, and you're right, there are some trends for it happening in younger individuals, particularly colorectal cancer, where we've seen this shift. So we want to do everything we can for early detection and prevention. There are some lifestyle modifications that we should be aware of. Exercise, healthy diet, avoidance of obesity, I think are three of the most important things that people could do to help minimize the risk of cancer.
When you talk about these risks, and I'm thinking like how things have changed over the year, well, a lot of people are active. I mean, they try to be. But would you say that the diet and the food that we are all consuming, because it contributes to the obesity and it contributes to a lot of the quality of the food that we're putting into the system, is triggering this?
It's hard to make a 100% direct correlation, but we can associate improvements in diets like eating healthy vegetables and fiber-rich diets have been known to really minimize the risk. And we do see an obesity epidemic here in the United States that I think that's kind of the new risk factors. And some of the cancers associated with obesity are trending up. Things like uterus cancer, pancreas cancer, colorectal cancer. So we do encourage, following the American Cancer Society and actually the Heart Association diets are very, very much in line with one another.
Yeah, that's a very good point. I wanted to put things a little bit into perspective, or if you could help us do that. When these reports come out and you hear, well, less people are dying, more younger people are getting cancer, does it perhaps go to the fact that more people are testing, even younger people are getting the message that, hey, the earlier the better, early detection, and so the more people testing, the more numbers are going to go up? Is there a correlation there? Or?
Well, we don't want to overdiagnose cancer.
Of course.
We want to diagnose cancer that's going to be relevant and need to be treated. So for younger people, I don't think it's a phenomenon that we're testing more commonly and finding it, because if we hadn't tested it, we would find it later in later stages. It would eventually become evident. So we do want to test early, and that's a good thing. That's not going to be finding cancers that we don't have to do with, particularly in the younger population. So for instance, in colorectal cancer, there's a recognition now of it happening earlier. So we want to do preventive steps and early detective steps at age 45 now instead of age 50. So simple stool tests or colonoscopies can sometimes be prevented because we could detect a polyp that eventually might turn into a colorectal cancer.
And the treatments and all the research have really, just by leaps and bounds, made things incredibly
It's so exciting. This
right?
this is a very optimistic time in cancer. There's so many new therapies. It's getting so complex, and it's important that you see a team of doctors that really have that subspecialization. So many new treatments are really making a difference in the cure rates of cancer.
Dr. Thomas Buckles with the Scripps Cancer Program. Thank you for all the work you do.
Thank you.
We're just sitting up here doing this.
And thanks for the popcorn.
You
Hey,
want
there's-
popcorn?
listen, Doc, is popcorn good for? It's good healthy
I mean,
eating.
maybe if you don't
Maybe without
smother
the
it in
salt and the butter.
butter.
But you feel free. Thank you again, Doctor.
Thank you.
Appreciate it.